Hello everyone, April here from Pelvic Balance. So you have been cleared for exercise by your OBGYN or midwife or whoever you've seen for your postpartum visit. And what does that mean exactly? Well, it doesn't mean a whole lot because if you have already experienced this, you may be thinking, well, I'm sure it doesn't mean that I can just go back to doing what I did prior to pregnancy or maybe even during pregnancy, but you're not quite sure where to start. And a lot of women are really lacking guidance when it comes to how to help their bodies heal in the postpartum period. And when I say postpartum, that pretty much means anytime after you've had a baby. Everyone's timeline is different. People heal differently. So postpartum isn't just 6 weeks after birth. It lasts pretty much forever. So when you're thinking about getting back to exercise, it's very important to realize that your body did undergo a lot of changes, and the muscles that maybe you'll be calling on are going to be maybe quite weak. And we really need to start from a place of where you're at individually, because everyone is going to be in a different boat. So to try to do an exercise program that is very general may not be the best thing for you. And one thing that is important to consider is that you really want to know what condition the pelvic floor muscles are in, especially because they are such an important part of your core. They form the foundation for your core. And it's very important that they're working together with other muscles like your abdominals or your glutes or your diaphragm. We really want that all coordinated and working together well. How do you know if that's happening or not? Well, a pelvic floor physical therapist can help determine that. So just as you might go see a personal trainer who will evaluate you first day and decide maybe where your weaknesses are and what to work on to help you achieve your goals, a pelvic physical therapist will do the same thing, and more specific to the pelvic floor and maybe the rest of your core, pretty much anything that attaches to the pelvis. So they will be able to evaluate how those muscles are working. And that doesn't just mean how are they contracting, but how are they relaxing? Because those muscles have to do both of those things. They have to contract, relax, lengthen, and when that doesn't happen, there can be problems such as incontinence or pelvic pain, things like that. So you really want to start off from a good place and make sure that your foundation is working well. And then you can build on that with whatever other exercises you want to do. So that would be my tip for postpartum healing and getting back into exercise. A consultation is definitely a good place to start to determine what your goals are and how pelvic physical therapy may be able to help you. So if this sounds good to you, feel free to reach out to me, April@pelvicbalance.com, with any other questions. Thank you and have a great day.